Now, you are talking about kind of, I think, the pacemaker in the next generation. Do you think that there's anything in the future that's even...
Well, you even said this wireless stimulation. So I think there's going to be a time that we're going to be able to remotely pace the heart.
Wow.
Yeah. So with some targeted, probably there'll be a field generator. Now that's about 20, 30 years down the line.
Okay.
But we still have a lot of advances with these so-called leadless pacemakers. But they still need contact with the heart itself.
Right.
There's going to be a time that we could probably implant something subcutaneously over the heart and have some kind of targeted field that's able to pace various spots in the heart and maybe do multi-site pacing, more physiological pacing than we're able to right now.
Well,
that's almost science fiction.
I was just getting ready to say that's almost
Almost
sci-fi stuff.
Yeah.
Now, you're lucky that you're in a field where a lot of physicians either they do maintenance on patients, they try to make the symptoms less, or they try to slow down the progression of a disease.
Right.
But you're in a field where you actually get to cure some patients with ablating and things like that. Now,
Right.
Tell me a little bit about the ablating and where that has been and where it's going.
Well, so ablation is a field, so we're able to tackle more kinds of arrhythmias with ablation than we used to. The gold standard when I was, and if I've been doing this for 30 years, the field's about 30 years old.
Right.
So I've seen it all. But when we first started, our big excitement was patients with Wolff-Parkinson-White syndrome because they had arrhythmia, they had rapid heart rhythms, and they had an abnormal EKG, what we call a delta wave on EKG. And we were able to ablate. This was an extra electrical connection between the top and the bottom of the heart. We were able to map where it's coming from. And it's really just mapping out electrical pathways, pacing from one spot, seeing where the electricity gets through, and finding the appropriate location to apply a small radiofrequency current that heats up the tip of our catheter and causes a small burn.
Right.
And the impressive thing about that, and what still to this day is sort of our magic moment. So the magic moment for the electrophysiologist is applying the radiofrequency energy and within 1 second, within one beat, seeing the delta wave go away. And that patient's cured for the rest of his life.
Right.
Unfortunately, now the pediatric electrophysiologists are getting all those patients and we don't see as many anymore. So the less magic moment is people who come in with supraventricular tachycardia, have repeated episodes. We're able to ablate those. It's not as dramatic. We don't see any change on the surface EKG, but we fix the problem.
Right.
It's a hidden cable, basically, and we fix it, and we can't tell right away, hey, it's gone, we fixed it. But when the patient comes back in a few months and said, you changed my life,
Right.
That's it. So those two, arrhythmias are pretty standard treatment, able to fix them. Other things not quite as easy. For example, PVCs or ventricular ectopic beats, we're able to fix, but it's a little more troublesome. It's not 100%. And
Will they move around on you sometimes?
Sometimes they move. Sometimes we fix the spot and then they come back a year or two later with a different spot. And it's a little more tricky. And the bigger problem that we have, and that what keeps us busy the most, is atrial fibrillation,
Right.
which is a disease that has sort of an early and a late pattern of onset in patients. And the early patients that are predisposed to it genetically, and we catch early, we can fix them. But the problem is if we fix them in their 30s and 40s, they still have a risk of coming back when we all have a risk of developing that. So there's two parts. It's a genetic disease and it's a degenerative disease. And any kind of predisposing factor for cardiac disease would be a predisposing factor for atrial fib, like hypertension and diabetes and
Right.
caffeinated intake and stuff like that.